Good morning, everyone. Today I want to talk to you about psychology and mental health and your mindset and dentistry. And probably I'm a little bit nervous in this video because I don't usually record in public with a lot of people around. There are people behind me, there are people in front of me. And the reason I'm doing that because I'm trying to encourage myself to be more courageous and be more brave and with doing things outside my comfort zone. So I'm a little bit nervous in this video because I'm in a very different environment than where I usually record. Usually I record in very quiet places or quiet areas, but there's a lot of people around in front and behind me as well. So might be a bit of a long video, this one. And what I want to start with is I'll talk about myself first. For doing dentistry is not easy for many dentists, including myself, especially in my first years. Dentistry is a very exhausting mentally profession. You're dealing with patients who are scared to see you. Sometimes they walk in and say, I hate you, nothing personal, I hate the dentist. You're dealing with very confined areas. You're working on within a fraction of millimeters sometimes, or microns when you're doing like crowns or root canal treatments. You have to deliver excellent service, excellent customer care. You have to listen to patients. You have to listen to their problems, deal with staff, you deal with, if you're a practice owner, you deal with the business side of dentistry as well. So technically and mentally, it's a very exhausting profession and it can drain you very easily. But what I've learned about myself, a lot of other dentists as well, is a lot of the profession attracts a lot of dentists that kind of like perfectionists, and a lot of perfectionists are driven by, I would say, some sort of trauma in their childhood, and this trauma has affected them in a way that put a lot of pressure on them to excel and to prove that they are self-worthy, and somehow they get attracted to that profession as well. So if you have a lot of undealt traumas or undealt issues, you will carry it. Imagine you're walking into your work or your practice and you're carrying a big, massive, heavy baggage, and this luggage is full of all your problems. You walk into the practice holding it in your hands. Just imagine that. And you're welcoming your patients in the front room. It's like, hey, walk with me to the room. And you're walking with them holding this luggage. You sit them on the bench, like, excuse me, I'm just going to put my luggage on the floor. And you just put this heavy bag in. And then you talk to the patient. And then you start treat them and you're pushing your luggage out of the way. Then you walk them out carrying this luggage. And the whole day you're doing dentistry, which is difficult. And you have to speak to patients. And you have to perform in high level. And you're carrying this massive load of luggage or baggage on your shoulders the whole day. Of course, after you finish by 5 p.m., you will have no desire to do anything in life. You will be very upset, very sad, very angry, very miserable as well. So my advice to you is, I don't see any problem, whether you think you have problems or not, of seeing a psychologist early in your career. And seeing a psychologist, even if you have no problems, think of it as seeing a dentist and you have no dental pain. These dentists might be more proactive and they might identify some airway issues, grinding issues that you're not aware of. They might identify some occlusal imbalance in your bite. They might fix a chronic problem that you're not aware of. That will improve your life. They might improve your sleep and you end up with more energy. Same thing, if you go to a psychologist early on in your career, just simply say, hey, I want to excel in my career. I don't think I have any problems, but I want to make sure I can thrive in this career in the next 20 or 30 years. What advice do you give me? And then they might start to, if they recognize they don't have any problems, they might give you tools to even make your mindset in the most positive way so you can work without any problems. Or better, they might identify some baggage that you're carrying with you, and they might be able to help you manage through them and help you to resolve them and then make your career more fruitful. But an important warning: seeing a bad psychologist or an incompetent psychologist is like seeing an incompetent dentist. Imagine you see an incompetent dentist and you have a small cavity, and this end up drilling into the nerve and then causing a perforation. You end up with an extraction, put a dodgy implant, the implant will fail, and then when the implant fails, the tooth next door to it will fail as well, and they try to put a second implant. There is not enough bones, they perforate sinus perforated. What I'm getting into, if you see an incompetent psychologist, they can open unnecessarily wounds and wouldn't be able to know how to close it or deal with it again or manage it for you. The aim is not to get rid of the trauma. The aim is those luggage, you're always going to carry them with you all your life. But the difference, instead of carrying this heavy luggage and working, you put it under you and use it as your chair and use it as a force to lift you up. So a good psychologist will be able to help you live and manage your life without necessarily deleting those traumas or those problems. Instead, uses energy to excel. Energy cannot be created or dissipated or eliminated. Energy can only be transformed from one form to another. All those problems are energy. And you can use this energy to damage yourself or drag yourself down, or you can use this energy in the right way to lift yourself up and use it as a driving force to excel even more in your career. So my advice, see a competent, good psychologist, even if you have to wait. There's a long way to see them. Even if they are more expensive, if they're not covered by Medicare, they're not covered by any Medicare programs, they have private high billing fees, it could be worth it. Seeing an incompetent psychologist can have a detrimental effect on you, but seeing a competent psychologist will make a huge difference whether you have problems or not. Another thing probably I want to share with you as well, other than seeing a psychologist, it's an exercise. Let's say you are an associate dentist or you're a practice owner, you're in a very tough position in life at the moment, you're struggling, everything is, you're carrying a heavy luggage or baggage, as we said before. And before seeing a psychologist, it's like a 6 months wait and you're really like struggling. What can you do as a short-term fix? And I'll give you an exercise that I do every now and then. And this exercise is really helpful exercise. It was very helpful. I still do it every few months. On a list of paper, get a paper, divide it into 2 columns. One column, write, and you have to be very honest with yourself, super honest. Write in one column all the things or activities that put you in a good energy or a good state of mind. And on the other column, write all the things that put you in a bad energy or a bad state of mind. And again, it's a very personal list, but I'll give you an example. For example, it could be walking on the beach, put you in a positive state of mind. Playing certain types of food, let's say playing football, watching certain comedy shows, whatever that put you in a positive state of mind, certain type of food that you eat, that you enjoy eating, dining out, whatever it is that put you in a positive state, put it, or a high energy state, put it in one column. On the other column, put all the list of things that put you in a negative mindset. It could be doing root canal treatment. I don't know. I'm giving you an example here. Everyone hates root canal treatments, including myself, after many years of doing them. Could be periodontal treatment. It could be seeing patients who are divas and demanding, and could be your boss at work. A certain human being are in your life, a family member, a parent, a spouse, a school run in the morning, or whatever it is. Write it down. It's very personal. Then from there, classify them into the top and the bottom of the list. So high state, what is the thing that put you in the high state ever? Second, third, and fourth. And again, on the negative list or the negative mindset, what is the thing that puts you in the most negative mindset and put it on the top of the list? Then from there, your job, until you can see a good psychologist, is to eliminate as much as you can the things on the negative list or minimize them, and do the things on the positive list as much as you can. Do more of them. Trust me, by default, your mindset will change and your energy will change. But here are the things with the negative things, the list of negative things. You have 3 options. Option one, number 1 is the best one, is change it. Change this problem, change situation. If you have the power to change it, do it. Power as, let's say you're in a level in your career where you can get rid of root canal treatments. You don't have to do it. Financially, you don't have to do it. You have someone you can refer to, then do it. But you could be a new grad and you cannot dismiss that. Then what the second thing is, walk away from situation if you can. Now, again, if you have the power to change jobs or change situation or walk away from it, then do it. What if you can't? The third thing, change yourself to suit the situation temporarily until you have the second or third power, which is change the situation or walking out. So change yourself how you see it. So let's say you might root canal treatments, you might book longer appointments. You might take another course with an endodontist. You might do one-on-one mentoring, pay someone even a lot of money to sit with them one-on-one, an endodontist, to do root canal treatments, go and observe them and see exactly what files are using and how they're using it and what they are doing differently, and try to learn from them. So change yourself to fit the situation until you have the power eventually to change it, or until you have the power to walk away from it. Could be a short term or long term. So it could be a situation where the school runs, the schooling, where you live, it's gonna be hard to change. And it's gonna be hard to hire a nanny or a driver to take over this. You might have to move houses or move suburbs even. And this is not gonna happen in 2 or 3 years. So but at least put it down on a paper, write it down, that in 3 years you wanna be moved from X to Y. Then you have something written, you have a plan to work towards too. So good psychologist, list of good or things that put you in a positive mindset, list of things that put you in a negative mindset, including this ant trying to bite me, and try to work on this list until you can see a good, competent psychologist that can help you, whether you have problems, even if you don't have problems. If you find this information helpful, please make sure you like and share it. I honestly, sincerely wish that if you're going through a hard time, you find ways to get out of the situation, hopefully have a better mindset and a better time. Or if you're having a great time, hopefully you can have even much better time, and you can start spreading this energy to other people who are struggling around you, and you can be the force to lift them up and fix their problems and help them manage their problems. Please subscribe to my channel and turn the notification on so I can share with you any new information. Thank you so much for listening. It means a lot to me.